Leading advocates, experts and stakeholders at this national symposium say to stem the negative tide of human capital flight of Nigerian medical practitioners to other climes, push factors such as poor funding of the health sector, stressful medical education, impediment of the National Youth Service Corps to medically trained doctors, poor remuneration in the face of high inflation, unhealthy rivalry in the health sector, insecurity among others must be addressed.
Well, we'll understand that we may not have the very, very good environment that they expect us to have. Government still has a role to play, and even individuals still have roles to play to show that they care about Nigeria. The health sector of Nigeria is very, very important if we are going to have a productive national economy.
Seeing that even nurses, midwives, and some community health workers have, joined the pattern of migration. If Nigeria is to achieve universal health coverage and take health to the hard-to-reach areas, we have to start to think positively about the human resource for health gap that's now widening. One of the things that we'll start to see is that there will be inequalities. People at the periphery and the peri-urban centers won't have access to, health care, unlike people who are in the urban centers.
Issues of sustaining child, maternal, family planning, as well as getting more young women into the healthcare field also got priority attention.
If we want to really improve the healthcare situation, especially at the primary care level and for women's health, we need to ensure that girls have the same opportunities for economic growth, and to enter, we have to facilitate and encourage them to join healthcare workforce.
But to ensure medical practice is more attractive in the country, there is the need to implement favorable government policies, incentives and better remuneration.
When you talk about funding the health sector, if Nigeria and other governments, head of governments in Africa in 2001 met in Abuja and agreed that it will take 15% of annual budget to properly run the health sector in Africa, why are we still talking of 5%, 4.5%? 2023 is 5.75%.
The Federal Ministry of Health says it is working to identify strategies and mechanisms for sustainable financing as part of a wider search for solutions.
So government is looking for a way to increase the facilities, improve the infrastructure, improve incentives to be able to attract some of these personnel back to Nigeria. And then the issue of bonding, having trained a very high proportion of these people with government or taxpayers' funds.
As part of efforts to enable Nigeria to achieve universal health coverage by 2030, the Presidential Health Reform Committee is set to review and implement recommendations at the symposium to improve the country's workforce. Aisha Salihu, Trust TV News, Abuja.